Hello, beautiful souls, and welcome to another episode of the Indigo Womb Wisdom Podcast. I'm your host and sister friend, Shatia Tee Owsley, and thank you for watching and or listening. So sit back, grab some tea and a notebook, and let's vibe together as we have organic and practical conversations embracing intuitive womb wisdom, spirituality, and a sprinkle of magic to rebel, restore, and radiate overall wellness in our lives. Hello, everyone, and welcome back to another episode of the Indigo Womb Podcast. I am your host and sister friend, Shatia Tee Owsley, and today I would like to introduce our guest, Dr. Tieya Qualls. So happy to have you here today.
Thank you for having me.
Absolutely. Just a little bit about Dr. Tieya. She is a licensed physical therapist and the founder of Quality Touch Physical Therapy and Wellness, a holistic practice serving the DC metro area. With over 19 years of experience, she integrates traditional PT with yoga, mindfulness, body work, and fitness to support whole person healing, especially for those navigating pregnancy, postpartum recovery, and pelvic health changes. She is certified in pelvic rehabilitation, yoga, prenatal yoga, and is a certified birth doula who values supporting clients through vulnerable life transitions. Dr. Tieya earned her degrees from Hampton University and Howard University and has worked across many physical therapy settings. She has served as an adjunct professor at Howard University and is an APTA credentialed clinical instructor. Her work blends advanced manual therapy and trauma-informed care with a deep respect for the mind-body connection. Outside of the clinic, she enjoys yoga, fitness, book club, and bowling with her loved ones. And I am so happy to have you here today, Dr. Tieya.
I'm so glad to be here. I'm excited.
Yeah, so I read your bio and it is wonderful and it is beautiful and you are doing all of the things. And if y'all haven't, y'all will, she's going to give you all of her at so you guys can check her out because she is always dropping gems on TikTok and other social media platforms as well. But knowing all of the things that you are doing, please just introduce yourself. Let us know who Dr. T is and how you got started in this field.
Absolutely. So you did a wonderful job. I will try. So as you mentioned, I'm Dr. Tieya. I am the owner of Quality Touch. So Quality Touch Physical Therapy and Wellness, we're a mobile company. We provide services in the DC metropolitan area, DC, Maryland, and Virginia. And those services are a combination of physical therapy, birth support, and yoga and wellness services. We do specialize in pelvic health, and that's pelvic health for all genders, whether you're born female, whether you're born male. If you are transgender, non-binary, we treat all individuals with the pelvis, which is everybody for the most part. And we also treat all ages. So I work with those pediatrics through geriatrics. Now, with regard to physical therapy, I tend to work a lot with patients who have painful intercourse, whether it be due to vaginismus, if you're familiar with that term, vulvodynia.
Okay, Dr. T, wait a minute. I gotta stop you. So you're gonna have to educate us a little bit, even giving us just a little bit. So
Vaginismus is a common condition where people may have trouble receiving penetration, and that could be either through intimacy or it could be something that's very common to many women, biological women, with insertion of a tampon, for instance, or even getting a pelvic exam. So we want to make sure that people have that function or those functions. So that's one thing that I would work with. I also work with clients who have vulvodynia, which simply means painful vulva or the outside of the genital region. So with that, it can stem from a lot of different causes. So we generally will work with clients on trying to improve or eliminate the symptoms associated with that. Treat clients who have urinary leakage, That could be leakage with a simple urge to urinate, or it could be leakage when you cough, laugh, or sneeze. I also treat clients with bowel issues. So a lot of people don't think that bowel issues could be treated by a physical therapist, but a pelvic floor PT can treat that. And that could be constipation. It could be diarrhea. It could be trouble with holding in gas, so forth and so on. Even things like hemorrhoids and anal fissures. I work on gentlemen who may be having erectile dysfunction, as long as it's medically cleared to not involve the vascular system. Work with gentlemen who may have just had surgery, such as like prostate surgery, things like that. I also work with women who've just had hysterectomy or endometriosis related surgeries. And let me think, is there anything else that stands out?
Too, Dr. T.
Fibroids, yes, thank you. PCOS, fibroids. So anything related to the genital region, the reproductive health region, we as pelvic floor physical therapists work with those clients. And then for little ones, of course, they're not necessarily going to have those same kind of conditions.
Mm-hmm.
I work with little ones that have a really tough time with bedwetting. Oftentimes you may think, oh, they'll just grow out of it, but sometimes it could be related to things such as chronic constipation for the little ones or other neurological conditions. So I work with those little ones on that. We work a little differently with the little kids. Of course, it's not going to be the same kind of care, but we do work with them to improve those kind of things. And then for maybe those teenagers that might be experiencing pelvic tension, particularly I think about my young women who may be having a menstrual cycle and they may have pain with inserting a tampon if they're interested in that, or cup, a disc. Sometimes with the menstrual pain, I work with them for those things. So things like that. Those are some of the things that I work with as a pelvic floor physical therapist. Now, as a birth doula, I do provide birth support throughout the entire journey. So I help people with preparing for labor and delivery. We offer a class called a Safe Push Prep class. And I know a lot of people, whether you're an experienced birther or someone who is giving birth for the first time, could benefit from learning the ABCs of pushing, the mechanics of pushing, how to do it properly. We want to make sure that you feel like you understand what that involves. Sometimes when I do get a client who's had a delivery before, they might say, oh, when they told me to push the first time, I didn't even know what that meant. So this is what this particular class is for. The reason why we want to teach that is because it can help with preventing tears of the tissue around the opening of the vaginal area or anal area. It can also help to hopefully prevent excessive forces that can cause pelvic prolapse. And for those that don't know what that is, that's where people can sometimes experience a feeling of heaviness right around the vulvo-vaginal area, anal area. They could sometimes actually feel or see a bulge in that area. It can be very concerning. So we work with clients to help hopefully give them best practice for pushing to prevent either those conditions at all, or at least preventing the severity of them. And then I also do in-person birth support. So I attend births for clients who would like to have me there as a birth doula. I, obviously advocate for my clients. I want to make sure that they understand the things that are being brought to them, whether it be just new information from their provider or things they may have seen on the internet, so forth and so on. I like to make sure that I am just giving them tips about how to best prepare their body. Because I am a pelvic floor physical therapist, I do think that does blend into my birth support. So I love to talk about the physical body, even nutritional elements within my scope, things like that. I will also work with them on a postpartum basis, not necessarily as a postpartum doula, but to provide them with those feel good type of things after they delivered baby. I then will incorporate yoga into my practice. As you mentioned, also prenatal yoga. So I work with my clients again throughout the full journey, providing them with customized one-on-one care or even small groups. I do that as well. I have worked with bigger organizations for group community outreach or community events as well, corporate wellness, then providing meditation services, mindfulness services. So those are pretty much the gamut of what I offer, but the most recent offering that I hadn't listed in my bio is that I've also recently created a new platform called PelviFlow. And PelviFlow is pelvic health specific yoga and meditation. And right now we actually are doing a series We're partnered with Spiritual Essence Yoga and Wellness in Upper Marlboro, Maryland, and we're doing a 4-week series. The series started a couple of weeks ago, so we have 2 more sessions left. One is this upcoming Saturday, April 20th, and then the following Saturday, May 3rd, and that's going to be from 2 to 4 p.m. However, no worries, because we are possibly going to be partnering with a few other organizations in the near future, so keep a lookout for more workshops. Those workshops are basically going to be teaching the participants all about all of the conditions and more that I mentioned earlier, how to incorporate yoga into your lifestyle to help with management and or healing of those particular conditions. I like to work with all bodies. I like to make sure that everyone is able to incorporate something into their day-to-day, even if they're not an experienced yogi. So that is something I found that is just very fulfilling. And then aside from that, just wanting to provide education. So I do speaking engagements and different kinds of chat and choose with groups as well.
Awesome. You are doing all the things. All the things. Yes, Dr. Taya. I would like to go back and just touch on a couple of things that you mentioned to get some additional information. We love the babies, and I love that you work with the babies. I would like to just dive a little bit deeper into the bedwetting,
Mhm.
because that is something that you do hear a lot, starting potty training, and you do hear the response, they'll grow out of it. But we're learning it's not just a grow out of it type of thing. There may be some other underlining concerns that may be happening or going on, and our babies need some additional support. So, for those parents who may be watching, can you kind of give us a little bit more insight on how you work with clients, or your babies who have bedwetting concerns, and what that may look like? What does a consult look like? What are some of the things that come up? Are they related? Because you did mention that it could be related to constipation or some neurological issues or concerns that may be going on. Can we just tap into that just a little bit?
Absolutely, absolutely. That's a good question. With bedwetting, there is an element that might be developmental. Like, we expect that they will quote unquote grow out of it. However, when it gets to a point where another provider may be involved, like they'll first probably see their pediatrician, for instance, then that's where they want to figure out why this may be occurring. 9 times out of 10, I found that I work with those who are experiencing chronic constipation. A lot of times the little ones might be maybe not getting enough nutrients in their day to day, because little kids are picky sometimes with what they want to eat. And most little kids aren't drinking enough water. And of course, they're not thinking about fiber. Who cares about fiber at that age? So, those sometimes can be the more simple fixes for that particular condition, is getting their bowels going.
Okay.
And the reason why the constipation can be linked to the bedwetting is because, of course, we know that, or as pelvic floor PTs, and maybe not a layperson, but we know that those organs, they share the same space. So our pelvis contains our bladder, it contains the contents of our intestinal tract, and obviously that's where we have our stool. And so let's say a child is not going to the bathroom regularly, and this is for any age individual, quite honestly. When you're not eliminating regularly, what can happen is the stool hardens and it stays in that canal waiting to expel. And for most of us, the rectum is going to start to form around that and grow and get stretchier. The rectum can stretch. It can get as big as whatever the contents that are in there. And so it just sits there. And so then you have the bladder in there fighting for some space too. And so what time of day are we most relaxed? When we're sleeping. So oftentimes with little kids, they may end up finding that they're bedwetting, not because they just are lazy or don't want to get up. They just might not be able to really control that. So that's one of the things we'll start to work on for some kids. Now, there are some kids that have more medical pathology associated with that, and it could be neurological in nature. And that's where we want to try to figure out what the medical interventions, and we're going to work with a team for that a lot of times, 9 times out of 10. Sometimes it could relate to some trauma for some kids, but also some adults. I've had adult bedwetters as well. And so, of course, we're working with our mental health providers, and with the physical therapists like myself, with the medical providers, things like that.
Okay. And what ages do you usually see this? so much information out here, especially when you start the potty training process, right? And how long it should take. You have some people that say you can do it in a weekend, and some people say you could do it in a week, or, just let the babies figure it out. So there's a lot of contradicting information out here. And when should you start to be concerned as a parent with the bedwetting?
Good question. I wouldn't say it's necessarily an age where I see it start, personally speaking. Usually, I'm going to say the concern may come if there's a regression. For instance, if they've been, having regular trips to the bathroom without, any kind of interruption, they had not been bedwetting before, and now all of a sudden they are, then that's where you definitely want to kind of pay a bit more attention. That's the type of experience I've had with a lot of my little clients, is that they were already potty trained. This wasn't usually at the beginning of their potty training phase, because we're not going to start trying to manage. We don't want to get them too confused in the beginning. We want them to, quote unquote, figure some of those things out with a little guidance. But let's say they were already potty trained and they were going on their own or with a little bit of cueing from parents. Then all of a sudden they start to regress. Then that may be a bit of concern, and we want to pay attention, not jump to conclusions, but just pay attention. And then obviously, if it becomes persistent, that's where you get the interventions involved so that they can not continue that. And I've seen it across a great range. I usually treat kids as young as 5 years old. I don't usually treat anyone less than that. It just worked out that way where I tend to get 5 and above. And then I've had bedwetting into the teenage years as well. And like I mentioned, I've had some adults who are bedwetters for a variety of reasons too.
And you also mentioned some of that could be related to severe stress or
Mhm.
some type of
Anxiety.
trauma
Yeah.
of why that is happening as well. And so when you're working with clients that experience that, are you also incorporating mindfulness
Mhm.
and as well as yoga and other, let's say, calming and spiritual and coping techniques to help them to journey through whatever this trauma is that they're experiencing?
Absolutely. And it also obviously depends on the person. Not everyone is open to those types of interventions. So those that are, I will try to incorporate that into the mix. And of course, it also depends on their understanding. Like a little kid, I'm not sitting there meditating with them. They're going to be like bored out of their mind. But I might do something fun with them. I might incorporate something mindful for a kid. It just all depends on the kid and what their interests are. When I do an evaluation with any person, I'm going to find out what their interests are. So that helps us to guide our sessions. But for those who are a little older and open to learning that particular type of style, then yes, I will incorporate mindfulness. And mindfulness actually, and mindfulness and meditation often get interchanged, but they're not
Mhm.
the exact same thing.
Correct.
So I will often incorporate something mindful for that person. So whether it's sitting quietly watching nature, or if it's pottery, or if it's painting, whatever it is that is mindful for them. And for those that don't know, mindfulness activities usually involve something that keeps our body in a state of calm for a length of time. This could be 60 seconds, this could be 60 minutes, or whatever time frame in between. There is no right or wrong. It's a method of calming down our central nervous system, our fight or flight system, which a lot of people are familiar with, because when our fight or flight system is revved up, oftentimes our body systems respond, and that could be by way of bedwetting or even daytime leakage for some strange reason. A lot of times, those individuals who have high stress jobs, or even if they aren't looking frazzled, some people are looking cool as a cucumber on the outside, but they are very type A, they are very perfectionist driven. That type of personality can sometimes lend to those types of conditions as well. And we see that even in teenagers with the expectations on grades, college. I got to win at this sport, whatever the case may be. It can really be a domino effect for sure.
And so another thing, what is regular for a person? How often should we be using the bathroom, Dr.?
Yes, good question. I love talking about this stuff. So regular is going to vary from person to person. First of all, it can be as frequent as 3 times a day. It can be as low frequency as 3 times a week. That's regular for each individual. We don't want it usually less than that because we usually see more issues when it's less than 3 times a week. And so what that means is that when you're going, you're not straining to go. You are going and the stool isn't hard or too firm. And what that looks like, we have a scale we look at as far as what the stool should appear as. If your stool is looking like pebbles coming out in the toilet, or formed pebbles, like it's a piece together, but it's formed in little balls or whatever, then you likely need to start working on the bowels a bit more because that is a form of constipation. If it is, maybe it's not super hard, but it's taken a long time to initiate, like you're on a toilet for a long time, those are times where you may want to seek some care from a pelvic floor physical therapist. That's what we would consider to be irregular, if you want to use that term. Now, with that said, we also don't want the stool to be super soft. So it's a sweet spot for this. We want the stool to be along the lines of a banana that's not too ripe. We don't want the stool to be so soft that it's mushy or really chopping up or coming out in bits and pieces. Because even though we often think of strain with hard stool, you can also have strain when you have soft stool or loose stool because your anal tissue, your anal muscles still have to fight to keep it in. So there's a sweet spot we look at so we can make sure you have really healthy bowels.
And do you recommend probiotics for the little babies and kids as well as adults? Or is that something where it's like a personal preference and you lean more to nutrition, right? And making sure that you're getting your leafy greens and making sure that you're getting your fiber and making sure you're drinking enough water, which are all things that can help you have a regular stool for you, whatever regularity looks like for you.
So, as a physical therapist, we don't recommend any supplements, at least in the DMV, because that's not in our scope of practice. But what I will usually tell my clients is I've seen that these can be helpful. You may want to discuss this with your medical provider. So, that's something that we would tell them to discuss with their primary care physician, their pediatrician, or even a gastroenterologist. A gastroenterologist, someone who actually does that type of prescribing, quote unquote, even if it's a supplement.
Okay, awesome. All right. And then I wanted to touch on Safe Push. I love the name. I love Safe Push. And I would like to hear more because a lot of times, whether it's on TV, more so on documentaries, right? Or even in being in the delivery room, many times you hear bear down
Yes.
and push like you're having a bowel movement.
Yes.
Right. And so when you said safe push, I was like, oh, I have to ask Dr. T, is that the correct way to push? Or does it depend on the position that you're in? Does it depend? What are the dependencies that, lead to safe pushing in labor?
But these are good questions. I like these questions. So first things first, I always say safe pushing is the push that you're going to do, that you're going to feel instinctive with, that's going to work for you and your body. So it could be any position, it can be any method. However, from a physical or mechanics standpoint, what we as pelvic floor physical therapists understand is that certain mechanics will put you in a more optimal position to put slack on the tissues around the opening so that there's hopefully not a lot of stretching and tearing, overstretching, over tearing. I'm not talking about the stretch that we expect because a baby is coming out of your body if you're delivering vaginally, but we don't want there to be long periods of pushing. We don't really want you to be pushing more than an hour or so. If we can do 30 minutes to an hour, great. We want to definitely try to stay less than 2 hours, just because the longer you're in that push phase, the more strain that you're having on those tissues. So one element of injury can occur with just the prolonged push. The other element is the too quick push. If you're delivering like a precipitous labor, and for those of you all who are not familiar, that just means you deliver really quickly. There was from the start of contractions to delivery was really, really short. When that happens, the tissues can get damaged as well. So we generally want to try to keep clients, their tissues in a state of push or stretch that is somewhat controlled. I hate to use that word because we can't really control it, but we just want to make sure that the baby is progressing as they should be so that there's less opportunities for injury. And then you asked another question, and I can't remember what that was. You were asking
The position and
yeah,
is there a specific
the
position
position.
that is best?
So I like a few different positions. I like some more than others. Typically, what we see in hospital settings or on TV is you're on your back, the legs are wide, knees are wide. Now, from a mechanics standpoint, with the wide knees position, that's going to actually put more strain across the opening of the vagina. So what we'll recommend is that you try to, turn your knees in. That doesn't mean your knees are closed because your legs have to be open, but your knees, instead of being open wide, they are actually turned in. So the knees are in, the feet are out. I know that's hard to visualize for people who are not like in the yoga world, but essentially that position of the what we call internal hip rotation, it puts some slack across that perineum tissue and around the vaginal opening. Now, in addition to that, being in a different position, like on your side or on your hands and knees, if that facility is able to let you do that, then that can actually be great for helping the birther relax so that one, they're not feeling, some people feel constrained on their back. Some people aren't comfortable by that stage on their back. So if you're too tired to be on hands and knees, try side lying and doing that same position with that top leg slightly like internally rotated at the knee, a little something under the bottom leg to mimic that same position, just to keep that tissue from being pulled so taut. If you can and want to be on hands and knees, I like that position. Oftentimes the feedback I get is that they feel more in control because they're holding their body up essentially, and then gravity may be helping a little bit more. There are some options like if you're in a home birth setting or maybe a birth center where people deliver in a squat position. Some people feel really in control there. So there are a ton of different options. On the back, even if you're on your back, there are methods we can do to help with that as well.
Okay. Okay. Awesome. And so I know that you are partnering. Well, let me see. So are you also doing workshops for Safe Push as well? Or
So
how would people go about learning more about Safe Push or wanting to take your class with Safe Push?
absolutely. Well, Safe Push currently, I'm offering it as a one-on-one offering. So myself and then the birthing individual and their partner, if they have one. So we usually do a set up a time where we can meet. That I usually expect that we're going to be together for about 2 to 3 hours. So it's very important that they schedule sooner than later. A sweet spot of scheduling is anywhere between 20 and 35 weeks. Now, I've had people that do earlier or later. The reason why I like to do it within that time is because I want you to have time to practice. I don't want the day of the delivery be the first time you did it. And then, with so much information being presented to people when they're pregnant, I just don't want them to feel overwhelmed trying to remember a whole lot of things. So I usually recommend that for now. However, I am trying to come up with a workshop style where we can have multiple couples or multiple individuals just to make it more accessible. Because, of course, if you're utilizing 2, 3 hours, it's going to be a little bit more pricier. So hopefully we can develop, and we're in the process of developing something for small groups. I don't want it to be super crowded because I want to give you some individualized attention, but maybe somewhere between 4 and 6 couples so that we can kind of make it a little bit more accessible.
I love that. I love that, Doctor. Dr. T, you have to let me know because
Okay.
I love this Safe Push for
Yeah.
sure. I need to send some people over
Yeah.
to you. For sure. I love it. And so during Safe Push and when you're teaching Safe Push, are there any tools that you're using with Safe Push too? Are you using the peanut ball, the yoga ball? What tools are best used when you are teaching Safe Push?
All of the above. So,
Okay.
as a doula, that's the one thing I love about having these multiple roles because they kind of blend all into each other. So, I'm teaching birth work techniques in my Safe Push prep class. And obviously, from the physical therapy standpoint, the mechanics, the exercise, the body, the anatomy, the physiology. So, that's how I'm blending those worlds together. So, yes, I'm using the peanut ball, I'm using the birth ball, depending on I am teaching breath, I'm teaching different breathing techniques. I am going over the anatomy and physiology to a certain extent. I'm not getting like a lecture on it, but just trying to help people understand, hey, these are the things involved. And one thing you mentioned where you said how when you are told to bear down like you're taking a bowel movement, that is how those two things blend in because most people don't take a bowel movement in the way that they should. They strain, they hold their breath, and then they push down forcefully. Again, that's an effective way to have a bowel movement or to push a baby out. Your baby will come out, your bowels will come out, but will it injure the tissues? possibly more times than not. So we wanted to give you some options. And again, this is not a right or wrong, a good, better, or best. This is more so teaching you some strategies that you can incorporate that work best for you. And if bearing down is what's best for you, please do that, because I do not want anyone stressed when their little one is trying to come into the world. Whatever your brain will remember, do that. But I want to just give you some more tools in your toolbox.
Awesome. And since we're talking about going poop again,
Mm-hmm.
we just run it back.
That's right.
Do you recommend the poop stools and the poop seats to
Yes.
you put your
Yes.
feet up when you're using the bathroom?
Absolutely. Squatty potty. I'm a big proponent of squatty potty. Those are the OGs.
Mm-hmm.
Also, it's another one. I can't remember, the Tushy or something like that. I think that's another brand, a little fancier. But guess what? If you don't have either one of those, you can get some a step stool. You got a step stool in your house? Definitely put that little 3 or 6 inch step stool, the little kitty step stool for your kids to brush your teeth. You can
Yes.
grab that. Some people even turn their trash can over or put some thick books under their feet, some yoga blocks, whatever you can do. And the reason why that's a good tool is because when you are having a bowel movement, we want the anal muscles to relax, right? So from a mechanic standpoint, when your knees are higher than your hips, your feet are up on the stool, your knees are higher than your hips, that naturally relaxes the muscle that usually keeps everything in. So that's why we want your feet up. But we don't, some people will go up on their tiptoes. We don't want you actively putting your feet up because you're still contracting muscle. We want to have you settled in. So flat feet on that step stool, essentially. And height does matter. I'm 5'7", a little bit over 5'7". I might want a higher step stool for me, depending on how tall the toilet is as well. And then also we want to make sure that our torso is in a good position. So like a lot of times, some people may not tolerate being super upright when they are trying to sit in that position. You might have to lean forward. I teach people how to do weight shifting on the toilet if they feel like some people may have prolapse or may just have a hard time getting all their stool out. Instead of forcing it out or bearing down or sitting there for a long time, maybe shifting your weight side to side, forward, backward in a circle. Look, use your dance moves on the toilet. You got to wind the hips, do what you got to do. Breathing, just like having a baby, we want to breathe that out. We don't want to strain and close our throat because our throat and our pelvic floor are intertwined. So if we're closing up here, we're closing down there, which is not helping anything come out.
Mm-hmm.
So yeah, those are a couple of tips I would recommend.
Awesome. Awesome. And so, Dr. T, with all of the work, I love the integrative approach that you have. And I love that you work with so many different people, providers, holistic
Mhm.
health practitioners, really to provide wraparound care. Like I was just listening to all of the things that you do in order to help. One of the things that I love to hear from birth workers and just holistic health practitioners and PTs and OTs is just how they integrate all of their knowledge into the work that they do. And this is important because for new people coming into the birth field, it gives them insight into how grand and great and big and limitless their career can be in this field. If
Absolutely.
you decide to go into PT, you don't have to just choose PT and it be compartmentalized,
Yeah.
right? You can make it your own. And I love hearing journeys like this. I love hearing how you are able to integrate so many different practices in order to get the best outcome for the clients that you serve. And that in itself is absolutely beautiful. So I love that for sure. Is there any other information that you want to share with us in regards to pelvic flow? I want to learn more about it. If you guys don't know and this is your first time seeing Dr. T, she is on TikTok. She does classes, and I love to just watch how she just incorporates her education and practical skills that are not overwhelming, especially to new yogis coming in. And it also just helps you just kind of settle into your body and what's happening. It's not over your head. It's very approachable. It's very comfortable. Look at Dr. T. Like, look at her smile. So she makes you feel extremely comfortable. Let's talk a little bit more about pelvic flow, how you're integrating that into the community, what that looks like when you are teaching these workshops and these classes, and how pelvic flow is going to grow. So just give us all the tea on pelvic flow.
So pelvic flow kind of just came as I started to develop my own yoga practice. I've been doing yoga prior to being a physical therapist, but more so got serious about it where I was more consistent, probably about 12 years ago. And then more recent years, I decided, okay, I can go ahead and incorporate this into becoming a teacher. I was thinking, I'll be great at that. I enjoy it. More so, the one thing that drew me in was the mental health component. For those that know, a lot about me, I do manage anxiety and depression. So yoga for me was a tool for healing, for helping with conservative management. And so that's one of the big things that really drew me in, is that it was something conservative. I wanted to do something that was practical. So that's how I got involved with yoga for my own personal life. And then as I became more experienced and honestly got more confident, I feel like when I I'm 45 now, but when I got over 40, I got super confident. So I was like, you know what? I could do this, whatever, what can I do to heal and help other people? And that's how I incorporated it into my business. So Quality Touch got the overflow, so to speak. But Pelvic Flow came about because I wanted to be very intentional. I did not want to make life harder for myself. And I wanted to also try to do something that felt authentic to me. And I love birth work. I love pelvic health. So why not? And I thought, what can be something that people would really be able to use in their day to day for their pelvic health? They may not be able to come to a pelvic floor physical therapist, for instance. They may not be able to afford or have a birth doula. So how can I create something accessible? And that's how Pelvic Flow was born, essentially. I right now I started off with trying to upload some YouTube videos, and I would tell you I'm Gen X. I'm Gen X. Look, I don't do all the technology like that. I do a little bit at a time. So be patient with me as I start to get more comfortable with the YouTube. So yeah, I'm trying to incorporate some videos, hopefully shorter ones. My first one was way too long because when I'm flowing, I'm just flowing. No one wants to do a 40-minute flow. So how about 10 minutes? How about 15 minutes? So I'm going to be uploading some 10 to 15-minute videos for a variety of ailments, whether it be prolapse, whether it be menstrual pain, whether it be perimenopause and menopause, whatever the painful intercourse, pregnancy. I have a prenatal flow up there, my pelvic flow. So those are things that I had started with. Now, then because I'm also an instructor at Spiritual Essence Yoga, that's my studio right there. I love, love, love Spiritual Essence and Dana and all of the team. So she gave us opportunity to do a workshop. So I was so excited because I was usually doing virtual care with my own practice, doing my one-on-ones. But I got an opportunity to do it in person. I was like, oh, this is great because I love doing the virtual, but I love being in person and having that energy, that exchange. So now it's coming into more of a workshop style, hopefully a regular class as well. So my goal or my thought is that I can take this to different places in the DMV, whether it be larger organizations, whether it be, medical organizations, individuals who want to do personal yoga parties, if you want to call it that, whatever the case may be. I just want to be able to bring it to others so that they can use it as a source of healing or preparation or just a source of recreation, quite honestly.
Yeah, I love it. I love it. So please check out Dr. T for her pelvic flow because it is absolutely, I told her before we started recording, if I could press love her videos more than once on TikTok, I would press it more than once. But you are adding so much value to people's lives. And I think that is definitely what we need in this state of the world that we're in. We
Yeah.
need a lot more grounding. We need to hug some more trees. We need to breathe and just kind of really give our nervous systems a rest from so much stuff that's going on. So I think what you're doing with pelvic flow provides that for so many. And I think that is absolutely amazing. As we start to close out, I want to know what is next for Dr. T. What are you doing? What is next for just the practice. What does it look like? What's the rest of your 2025? And what are you planning for? And how can we love on you and support you in what you're doing?
Oh, that's so sweet. So I'm figuring it out as I go along. But one thing that keeps popping up, and I'm going to say this out loud because otherwise I would drag my feet. I'm thinking about creating like a podcast, Pelvic Flow Conversations, or maybe name it after the IG for Pelvic Flow, which is xo.pelvicflow. So just a conversation surrounding all things pelvic health, incorporating the yoga, the breath work, and the pelvic floor physical therapy, but more of a relaxed style versus it being super clinical. I'm just trying to have general conversation with maybe some of my professional colleagues or some of my friends just to make it fun and inviting. So that's something that's in my purview. And aside from that, just continuing to grow the business. Business is definitely one of those things where you got to be prepared for anything. So just trying to grow it out, figuring out what that looks like. Currently, I'm a solo provider. I work by myself, which I enjoy, but I might want to grow out a team. So we'll see how that works and see how things come.
Yeah. So you guys heard it here first. Dr. T said she is working on this Pelvic Flow, XO Pelvic Flow podcast. Today is Friday, April 25th. 2025. We are all about love, support, and accountability. So you guys, when she drops her acts, when she gives us all her social media deets and how we can get in touch with her, please support Dr. T and give her that push. Hey, where are you on the podcast? What's happening and what's going on. So even if you just give us 5-minute segments, it's something and it adds value. And I'm going to tell you, this podcast today with you has been absolutely amazing because you have dropped so many different gems for so many different populations, right? So for whatever it is that you may have, what you're listening to, or even just curious to say, okay, when people think about PT, they don't think about pelvic floor health. They're not thinking about bedwetting. They're not thinking about safe pushing. They're not thinking about pelvic flow. They're not thinking about any of that. They're thinking about, I hurt my knee and I got to go to see the PT and they're going to give me some knee exercises, or I hurt my back, or I was in a car accident and I have to go see a physical therapist. And so I love that you shed a different light on what you can do as a physical therapist and all the different populations that you can, touch and help and be there for. And you are doing a dang on good job with it. And so thank you, Dr. D. Give us how can we find you? How can we support you, follow you? And for those who want to work with you, especially those who are in the DMV area. And if you do take virtual clients, how can they get in touch with you if they want to work with you virtually?
Absolutely. So again, my company is called Quality Touch Physical Therapy and Wellness. We're mobile, so we actually have the option for you to come to us. We are at our clinic location in Old Town Alexandria, Virginia, right off the waterfront. That's one option. We can also come to you at your home in the DC, Maryland, or Virginia region, depending on your distance. And then we also offer virtual options as well. And just a quick note about virtual care. A lot of people only associate PT with, I got to get my hands on someone. However, much of what we do as physical therapists is instructional, observational. So we do provide quality care on a virtual platform. And for those who may need to be seen in person, sometimes they transition to in person. Or I've seen some clients only exclusively virtually and they've progressed very well. So those are a couple of options for how we deliver care. Now, how you would reach us, you can reach us at our website, qualitytouchpt.com. Our email address is info@qualitytouchpt.com. And then you can reach us on our social sites at Quality Touch PT, all one word, or at our newest IG, which is at xo.pelvic flow, PELVI flow. We're on all the social sites, TikTok, we're on Threads, we're on Facebook, we're on IG, I think, and YouTube.
Awesome. So before we close out, I have one question that I always ask guests before they leave us. And with all the experience and everything that you have gone through, what you have seen, the good, the challenging, the indifferent, and just your growth over these years and all the work that you have done, what would you tell the little Dr. T?
Wow.
What would you tell your younger self?
Oh, that's a good question. You about to have tears flowing and everything. This is a therapy session up in here. No, what I would tell little Dr. T. I would tell my younger self I would just tell her to keep pushing, keep striving throughout all of the different ups and downs. It's going to all make sense in the end. And this is not, even now, this is not the end. We don't know what tomorrow looks like, but just keep pushing and striving. But one of the biggest things I would say for my younger self and younger, my yesterday self, but it's just to be free to be yourself. Like, just be yourself, be your authentic self 100% of the time because, that's who God created you to be.
We love it. We love it. Thank you so much, Dr. T, for being with us today. We honor and appreciate you. And we definitely will be sending you some love and we're sending you some support. And I hope that you guys reach out to Dr. T so that she can help you along on your healing journey in any type of way. She has so many gifts and talents. And I know that she will definitely touch you just the way that she has touched me, just by her presence and her energy. So thank you so much for being here today. Thank you, everybody, for watching today. Please like and subscribe and put your comments down below. And we will see you in the next episode. Bye.